I'm Dr. Alexander Jankov. I'm a hematologist and medical oncologist. I treat patients with various malignancies and cancers. I do specialize with a focus in breast cancer and gastrointestinal malignancies. Unfortunately, fatigue is an integral part of cancer diagnosis, treatment, and it's something that is rarely avoided in the life of cancer patients. It is also a question that is very difficult to answer on behalf of cancer doctors. Why? It's because the answer that cancer patients are not sometimes quite ready to hear. When the cancer patient asks me, I'm so fatigued, what is it that we can do about it? They receive counterintuitive answer. I tell them, you need to exercise more. This is not an easy answer. Sometimes when you don't feel like exercising and you feel malaised and fatigued and you have a lack of energy and you have different and various symptoms from your treatments, either surgery, radiation, or chemotherapy, and it's somewhat counterintuitive. Nevertheless, it is the best way to counteract cancer-related and treatment for cancer-related fatigue. Occasionally, I would hear the question, what is the difference between normal fatigue and cancer-related fatigue? I believe unless you had cancer, that is the question that you would not really think of it yourself. But it's a great question and requires somewhat nuanced answer. I believe the normal fatigue would usually be felt at the end of the day after a long day. And it is quite okay to be fatigued in the afternoon. As a matter of fact, we need a certain amount of fatigue in normal circumstances to prepare us for a refreshing all-night sleep. In terms of the cancer-related fatigue, a patient with cancer would feel fatigued even in the morning, would not feel refreshed from the sleep, would find a minimal amount of activities, even those activities that in the past were mastered and taken care of with minimal effort and without a problem, would now be exhausting to the patient. You do not necessarily need to receive chemotherapy to be fatigued. You can be fatigued just from cancer alone, but other procedures such as surgeries, especially major surgeries, radiation therapy would cause the fatigue. Fatigue also could manifest itself with lack of executive will, something that we imply in technical terms, but really means lack of will to do anything, to partake in activities of daily living together with your family, to do all other pleasurable activities that in the past you like doing or pursue doing. Good night's sleep is very important for every cancer patient. However, insomnia is a problem in cancer patients and is associated with a lot of discussion and questions that we receive in the clinic. Of course, one can try different sleeping aids, but there are also natural ways you can work on your insomnia. One of the best ways to do counteract insomnia is to pursue the physical exercise and activity sometime early in the morning. This will cause you to have a release of adrenaline, which will keep you pleasantly energized throughout the day, but by the end of the afternoon and early evening, you would feel tired, pleasantly, of course, and therefore you would easily fall asleep.